Hi, I'm Joe Roth. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and informing people about our life-saving mission. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of One-on-One with Steve Adubato has been provided by Activus in cooperation with the American Medicine Chest Challenge, MagnaCare, New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation, the law firm of Gibbons, P.C., Community Education Centers, PSE&G, committed to improving New Jersey's economy and strengthening its communities, and by Sun National Bank.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
Hi, I'm Steve Adubato. This is One-on-One. It is my pleasure to introduce Dr. James Wittig, Chief of Orthopedic Oncology, Hackensack University Medical Center. Good to see you, Doctor.
Hi, Steve.
I want to talk about this limb-sparing surgery that you're doing. You work in the area of sarcomas that people have. First of all, a sarcoma is another word for cancer?
Yeah, sure. A sarcoma is a cancer of the musculoskeletal system arising from usually either the bone or the soft tissues around the bone or the muscles.
So an orthopedic tumor, all right, these cancers. Well, an orthopedic tumor doesn't have to be cancerous. It could be benign as well.
Certainly. Mm-hmm.
But say we're talking about a sarcoma, orthopedic tumor, that is, in fact, a problem. They often happen, what parts of the body? Is it shoulder, knee, thigh?
Yeah, so your thigh is the most common site. And when you think about it, your thigh has got the most muscle and the most bone in the entire body. So probably that's the reason why it's one of the most common sites. Around the knee is very common, in the shoulder. And probably a lot of that has to do with those areas have very active growth plates. And children and adolescents are predisposed to getting tumors in those locations, and later the adult population.
We're about to show an x-ray of the shoulder area. I want you to talk to us about the shoulder area, which I was like, really? That could happen there? As we see the x-ray, talk about it a little bit.
Sure. So you see on the x-ray, that's the shoulder girdle. This is looking from the front of the patient to the back. And you see the scapula there, which houses the glenoid, or the cup. And then you see a long metal, what's called a modular segmental tumor prosthesis in that location. And this is a patient who had a cancerous tumor or a sarcoma developed from the proximal humerus. This particular sarcoma was called an osteosarcoma, and you can see that in this x-ray view. The upper part of the humerus, the part that forms the ball and socket of the shoulder joint, is affected by that tumor, and you see white, fluffy, cloud-like density arising from the upper part of that bone. And that white density is actually the sarcoma that's arisen from the bone and is producing bone itself.
You know what's so interesting here? As you describe that, I'm sitting there looking at the notes that say pre-1980 in a situation like this, or in the knee. Pre-1980, is it fair to say that the most common protocol, or very often it would be amputation?
Certainly, yeah. The most common way patients were treated with this were an amputation. And in the 1980s, chemotherapy was developed and somewhat perfected, and doctors and medical oncologists and orthopedic surgeons tried giving patients preoperative chemotherapy to kill the tumor, which they felt if they could kill the tumor before the surgery, it would make it much safer to take it out and let them achieve a wide margin on the tumor, a satisfactory margin to save the limb, as opposed to doing an amputation.
So today, limb-saving procedures much more common, right?
Certainly.
Why?
Yeah, about 95% of patients can be treated with a limb-sparing surgery who has a sarcoma, and a lot of that has to do with a combination of perfecting surgical techniques over the course of time, advances in imaging modalities, so that with an MRI you can see the exact dimensions of the tumor, know that it's not encasing the neurovascular structures which are necessary to save in order to save the limb, and then various chemotherapy protocols that have been developed that help kill the tumor.
Dr. Wittig, let me ask you this. It's more of a personal question than anything else. I'm curious about this. Your specialty is a fascinating one because you've had such an impact on so many people's lives. You save limbs, save lives. What caused you to go into this field? And did you have mentors that shaped your life in this profession?
Sure. Well, I think the main reason why I went into the field was because of the big impact that you can have on patients in terms of saving their lives and saving their limbs. And a big percentage of the population that develops sarcomas are children and adolescents. And watching those children be able to grow up and lead very productive lives in the future. I worked with two innovators in the field, Dr. Ralph Markov and Dr. Harold Dick, who were both at Columbia Presbyterian Medical Center when I did my residency. And both of them were innovators in terms of initiating limb-sparing surgery when amputations used to be performed. I saw many of their patients who were 20 years after having surgery and doing fantastic. And we would do operations together, so it was very fascinating work, and just really the impact and the dramatic results that you had with patients was very self-fulfilling.
What has it meant to you personally? Describe it.
Well, I feel everybody has, a purpose in life, and I feel that one of my talents has been able to do this type of surgery and to really help others, and that's what's been most important for me, is to help others who are in serious situations. And not only do we save their lives, but give them a great quality of life afterward, and that's very important.
Talk to me about where this field is moving forward, was going toward, because it seems to me that when we talk about pre-1980, that amputation was the most common protocol when someone had this kind of sarcoma in a certain area of their body. Great advancements in the last 30 plus years. Where do you see it moving toward?
Well, I think there's going to be more developments in the area of prosthetic reconstruction and different types of metal internal prostheses like joint replacements. There's going to be many innovations there that make them last longer and function better. But also on the medical side, I see where we're advancing toward better chemotherapy protocols, better medications that I wouldn't be surprised in 15, 20 years, you just take a pill for one of these and you probably don't even need surgery.
Seriously?
Seriously. Mm-hmm.
But there's a whole multidisciplinary approach, and it sounds so complicated, and then you say there's a pill. Doesn't sound like it makes sense.
Well, at some point in time, I might be out of a job, but
you'd be happy with that.
But I'd be happy with that. But you see, over the course of time, they're finding targeted genetic problems with these tumors, and they're targeting those specific problems with different drugs, and it turns the tumor off. And that's been very successful in one particular type of tumor called the gastrointestinal stromal tumor, which is a type of sarcoma that comes up in the GI tract, and patients take Gleevec, the tumor disappears. So.
Well, Doctor, you don't need me to tell you this because your patients and their families tell you all the time, but you're doing really important work, and everyone appreciates you doing it. Dr. James Wittig, Chief of Orthopedic Oncology at Hackensack University Medical Center. Thank you for joining us. We appreciate it.
Thank you very much.
Stay right there. One-on-one will continue right after this. Thank you, Doctor.
Thank you so much.
To see more one-on-one programs, visit us online at oneonone.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, Ph.D. and follow us on Twitter at Steve Adubato.
Dr. Tara Alvarez is Professor of Biomedical Engineering at NJIT, New Jersey Institute of Technology. She's also the Director of Biomedical Engineering, undergraduate program at NJIT. Good to see you, Doctor.
Thank you for having me.
You know, we're here to talk about so many things, but is it fair to say that you're studying what's called convergence insufficiency? It has something to do with eye movements?
Yes.
Explain this to me.
So basically what convergence insufficiency is, it's a problem teaming the eyes, or it's a binocular coordination problem. And most of us take our eye movements for granted because they work so well. However, for about 4 to 8% of the general population, and it's actually much more prevalent for those with brain injury, they have a problem coordinating their eyes, and this impacts their activities of daily living, such as reading, doing computer work, and then they just can't sustain vision at near.
So give us a concrete, relevant example where people are going to say, oh, so that's what you're talking about, because a lot of people watching right now are either experiencing this or they know someone who is.
So for the general population, many times it manifests in 2nd or 3rd grade, especially when the reading demand increases, because children have a hard time reading. And unfortunately, this is their only visual experience. So they don't know there's something wrong.
Reading is the first, you say, hold on.
Okay.
You're saying it's their only visual experience.
So for example, if you're starting to do reading for a long period of time, say 15 to 20 minutes, you can experience blurred or double vision, eye stress or strain, which is pulling around the eyes, or headaches.
Migraine sometimes.
Potentially.
Okay.
And then children tend to act up because this is uncomfortable for them. And many times it impedes their ability to learn. It doesn't mean that they have a learning disability, but they have difficulty getting the visual information into the brain.
But then how would someone know that the reason they're struggling is the reason you just described?
Well, you can go to an optometrist or an eye care professional, and they can measure what's called your near point of convergence, which is when you bring a target along midline, when do you perceive it as double? They can measure your fusional range, and they can also quantify your symptoms.
Okay, so breaking this down.
Okay.
This young person, this child, this 2nd grader, 3rd grader, 5th grader struggling with this. But it isn't just reading. They're looking at something on Blackboard. They're looking at a computer.
Right.
They're looking at a lot of different things, and their eyes are not converging in the way their eyes need to in order to receive that information accurately, process it, right? They're getting frustrated.
Right.
They don't understand what's going on. There's a learning issue. They're not performing as well in school.
Right.
You're studying what?
So I'm very fortunate.
Along with your team at NJIT.
Yes, and I'm also working with people at Dr. Mitchell Scheinman at Salus University and Dr. Clifton Shore from Berkeley. So my colleague, Dr. Scheinman from Salus, did a beautiful study showing that the efficacy of vision therapy works very well in that it improves your comfort level at near, and the symptoms are reduced at least a year after the therapy is finished. However, what's not known is really what's happening in the brain. And I'm working with Dr. Bharat Biswal, who's also with NJIT, to really understand the underlying neural mechanisms. And we're funded by the National Institute of Health to understand, record baseline.
That's the federal government.
Yes, yes. So it's our tax dollars at work.
Yes.
So to understand what changes in the eye movements, as well as what changes in the brain, where we'll be doing functional MRI recordings to see how exactly does the therapy have an impact onto the body.
Now you're a Ph.D.
Yes.
The medical community needs to know about this because they take this information and hopefully, I mean, the people watching right now are saying, first, this is fascinating,
Okay.
but more importantly, they're asking, okay, I'm hoping the clinical community is going to take this, the educational community, schools, that they're going to do something with this, right?
Yes.
Otherwise, why do the research?
Right.
Go ahead.
So one of the things also that the NEI, the National Institute of Health, is looking to do is community awareness. So many times this is not screened in the classrooms, and it can be easily addressed through therapy.
What kind of therapy?
So these eye movement exercises.
That's vision therapy that you're talking about?
Yes.
Okay.
So just bringing awareness to it will also increase the care for people that need it, that don't necessarily know that this is what they have.
Okay, but the other thing that I'm sure people are also wondering about, and I keep thinking about this, the ADD is, a lot of people talk about ADD, right? And I don't know how effectively it's being diagnosed or not, but children having a hard time concentrating in school, oh, that kid's ADD. People think they can diagnose it. But say it is diagnosed effectively by a trained professional. Is there a direct correlation? Has there been a correlation found between a child diagnosed properly with ADD and what it is you're describing?
Yes. So there's actually two different studies, one done by a group of optometrists where they've taken their patients that have been diagnosed with convergence insufficiency and see what the prevalence of ADD and ADHD is within their patient population, and another study done by psychologists who have a group of patients that have ADD, ADHD, and see what the prevalence of convergence insufficiency is. And it's roughly a 3-to-1 ratio. So
3-to-1 meaning?
Children with CI are 3 times more likely to have ADD.
Children with convergence insufficiency are 3 times more likely to have ADD or ADHD.
Right, and vice versa. Right. So it makes sense because many of the symptoms that children experience are very similar to those described in ADD. And from what we understand from the brain networks, the vision network and the attention network share a lot of the same neural substrates. So it makes sense. Now, what's very interesting is it's difficult. What Dr. Scheinman is being funded also by the NIH to study, which is an independent study of my own.
Real quick, go ahead.
Is to study how academic performance improves after vision therapy.
It could actually perform. Well, we don't know that, but he's studying that.
That's exactly what
And real
he's
quick on
funded to
brain
study.
injury, the connection?
So with brain injury, it makes sense that because so much of the neural substrates are dedicated to vision.
Substrates are?
Neural areas.
Got it.
So just parts of the brain.
Okay.
Are dedicated to vision. If you're in a car accident or you're coming back from war, it makes sense if you've had injury to the brain, then it can manifest as a vision problem.
Doctor, you and your colleagues at NJIT are doing such important work, and we thank you for coming on, talking about it, and more importantly, when you finish your research, please come back and share.
Will do.
Dr. Tara Alvarez from NJIT, thank you so much.
Thank
Stay
you.
right there. One-on-one will continue right after this. Thank you, Doctor.
To see more one-on-one programs, visit us online at oneonone.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, Ph.D. and follow us on Twitter at Steve Adubato.
We are proud to have Michael Pasterchick, Chief of Detectives, Monmouth County Prosecutor's Office. Good to see you, Michael.
Good to be here, Steve. Thank you for having me.
We're doing this series in cooperation with our friends at the Partnership for a Drug-Free New Jersey. You'll be seeing a website up throughout this program, the American Medicine Chest Challenge. We have an epidemic dealing with heroin.
We absolutely do.
What's going on?
Well, we've had a heroin problem in this state for a number of years now, but it's even more out of control, Steve. It's a #1 public health hazard that we're worried about in the law enforcement segment. Last year alone in Monmouth County, we had 68 overdose deaths from heroin, 68 lives lost to this drug that's enslaving our young people and our citizens.
What has been causing it to get worse in the last few years?
Well, it's always been there, but two things that are alarming to me. This is a suburban problem. This drug is out in all of our communities, and make no mistake about it. It's in our bedroom communities. It's in everybody's backyard. And what's really driving this is the high purities in New Jersey.
High purities?
The high purities
Break
of the
that
heroin.
down.
We have some of the highest purities of heroin in the nation. They do special testing on the heroin, and we have double the national average for purities of heroin on the streets of New Jersey. In New Jersey, we can buy heroin in $6, $7, $8, $9 bags at 95% pure. You can't buy any better heroin in the world, and we can buy it in small little dime bags, sometimes less than a 6-pack of beer, and we can buy, our young people can buy it on the streets of New Jersey.
Why is it so cheap, and why is it so available?
The reason it's cheap and available is, #1, we're between two major markets in Monmouth County, between Philadelphia and Newark, New Jersey. They have direct importation of the heroin.
Newark is a major market? I thought you were going to say New York.
Newark is the highest purity. Newark has higher purities than New York does right now.
Newark?
Newark, New Jersey, yes. And
Right.
Philadelphia has the highest purities in the country. And we in Monmouth County are situated between those two major markets where heroin comes in from Colombia. It's all the heroin that comes into the East Coast here is from Colombia. We have direct importation, and then the markets drive it in New Jersey, and we have these very extremely high purities. In New Jersey, unfortunately, it's estimated that 10% of the heroin addicts in the United States live in New Jersey.
10%?
That's correct.
One of 50 states?
That's correct.
You're involved in a very aggressive public awareness campaign, which is why you're with us today. Talk about it.
Well, we believe in being a DEA agent for 27 years. I've realized that we're not going to arrest our way out of this, Steve.
Why not? Why can't we just arrest everybody involved in the drug trade and in heroin? Can't do that?
Because there's always somebody selling it out there. We need to attack the demand side, and we need to do it through our prevention efforts and the media awareness, like you're doing here today, like we're doing out in the schools. Prosecutor Grabicioni has gone out to all the public schools talking to the parents.
That's Prosecutor down in your county?
That's correct, Chris Grabicioni. And we've gone out to all the schools and trying to spread the message, because we have to get to these young people.
What's the message to a 15-year-old?
Well, what we've chosen to do first, Steve, is we've chosen to talk to the parents first. And here's the reason why. We've gone out to all the parents groups at night. And we've had some big audiences, 400 or 500 people, because there was a study done years ago. And in that study, they asked high school students that were graduating high school that were drug-free. And the number one reason they were drug-free is they said they didn't want to disappoint their parents.
The number one reason?
That's the number one reason. And that's a real strong message for all of us as parents, to talk to our children, make sure they would feel they're disappointed if they go on a life of drug abuse. So that's why we've decided to go to the schools first. We've decided to use the media as PSAs and public service announcements to try and get the word out, because we can't just do it alone and through our enforcement efforts. And we've had some tremendous enforcement efforts in Monmouth County, but we also needed to be coupled with the demand reduction by talking to people and trying to reduce the demand, because quite frankly, once the young people start out using a bag of heroin, the statistics are not very good that they're ever going to go on and lead a productive life.
So the key is to try to prevent a young person from ever using in the first place.
Absolutely, and it starts out usually with prescription drug abuse, and then goes from there and goes into heroin abuse.
Talk about that piece, because more and more young people and others are ODing from prescription drugs.
Absolutely. And between the years 2006 and 2011, there were 16,000 overdose deaths. But the Attorney General just came out, the United States just came out in February. There were 16,000 overdose deaths from opiate pills in the United States those 4 years, from 2006 to 2011. Also during that same period of time, there was 3,000 heroin overdose deaths. We're a society of overprescribing. The young people start out trying to use these pills, or maybe even get hooked on them from an injury or whatever, and then they can't get them any longer. And when they start abusing them, so they go to heroin, which basically enslaves them usually for the rest of their life, if not killing them.
We have that site. Keep it up there, folks. The AmericanMedicineChest.com website. We're doing this program in cooperation with our partners at the Partnership for a Drug-Free New Jersey. And our friends at Activists and some other places have been committed to this effort. And the reason is, listen, those of us in the media have to be part of this effort, because we have this platform, and that's why we're doing it. Because if you cannot bring this information to folks, and they cannot keep getting it, you have to, why is it important to reinforce? I keep thinking about reinforcement. Someone says, I've seen that PSA before. And I'm thinking, why do we keep running the same PSAs as part of our series? If you watch in between our programs, there are PSAs. One of the reasons we keep running the PSA, why do we keep running the PSA?
It's too valuable, Steve. We have to save these lives.
Why do you keep repeating it, though? Tell folks why you repeat it.
Because there's a big yawn out there. People don't realize that this is going on, and the numbers and the people that are dying every day from heroin abuse. And we have to make a public awareness, because that's the only way we're going to get to save lives.
And repetition matters. Talk to me about Narcan. What is Narcan?
Narcan is it's a nasal spray that can reverse the effects of heroin abuse or overdose. When a person overdoses on heroin, you can spray Narcan into their nose. We've deployed it about 2 weeks ago in Monmouth County. Police officers now in Monmouth County, throughout Monmouth County, have Narcan, nasal Narcan. They spray it if they come upon a scene, which the officers are usually the first ones to get to a scene, not the usually emergency medical people. If the person has overdosed by heroin, and there's steps they can determine whether they've overdosed by heroin, they spray the Narcan into their nose, and it goes to the receptors where the opiates or the heroin have affected, and basically have stopped the breathing. And miraculously, people come back to life. People will just sit up and all of a sudden come right back to life immediately once the Narcan is sprayed into their nostrils.
How accessible is Narcan today?
We have it in almost all the police departments in Monmouth County. Ocean County has it. They've had it before us. Also, the governor last week just announced they're rolling it out throughout the rest of the state. It's out there saving lives. Just in 2 weeks, we've had 6 reversals in Monmouth County where we saved 6 lives that would have been lost to heroin or opiate overdoses in the last 2 weeks. We've saved 6 lives.
You know, you talk about all the work that you're doing down in your county, right?
Yes.
And there are 21 counties in New Jersey. You've got several states that we're seen in. People have to be asking themselves as they watch this program right now, well, how do I know what the government officials, what the law enforcement professionals are doing in our community as it relates to this heroin problem? Is it only going on in suburban New Jersey down at the Jersey Shore? Is it not something we need to be worried about? So my question to you is, what can the average citizen do to become more engaged in this effort?
Well, like I said earlier, too, I think the average citizen and the parents need to talk to their children. They need to talk to them about the perils of drug abuse and where it's leading. That's our biggest thing that we can attack this from, is starting with the young people when they're young, and talking to them about the problems with heroin abuse or even drug abuse in itself and where it leads to. Every parent in their home should be talking to their young people about the perils of drug abuse. And that's where it starts, quite frankly, Steve. And what we're doing throughout the state is, Narcan is being deployed throughout the state, but we're stepping up all our enforcement efforts, and as you can see, all of our media efforts, because we want the awareness out there. We need to get the awareness out about the perils of this drug that's enslaving and killing our young people.
Finally, a few seconds left. Is this personal to you?
It is. I was with DEA for 27 years, and you don't want to see these young people enslaved or worse yet, lose their life over a substance like heroin.
And when you're out there in these seminars, you see these young people, you know what they're facing.
Sure, and the odds are not good that they're ever going to beat it. Once they start, we got to get to them before they start, because the odds are not good that they're going to beat the addiction.
Listen, we appreciate everything you do. Thank you very much.
Thank you for having us.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Activus in cooperation with the American Medicine Chest Challenge, MagnaCare, New Jersey Sharing Network, the law firm of Gibbons, P.C., Community Education Centers, PSE&G, Sun National Bank. Promotional support provided by The Record, North Jersey's trusted source, and NorthJersey.com, and by New Jersey Monthly, the magazine of the Garden State, available at newsstands. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.
Play ball! Imagine you're enjoying your child's baseball game. As hard as it is to believe, one of the 9 children on the field may be abusing prescription drugs and getting them right out of your family's medicine chest. Join the American Medicine Chest Challenge by taking inventory and securing your medicine, safely disposing of your unwanted and expired medicine, and finally, talk to your kids. Visit AmericanMedicineChest.com to find out how.